The Ebola thing is rolling along, and of course, it's capturing 24/7 wall-to-wall cable TV coverage and whatnot. It's hey, if it bleeds, it leads, and Ebola really makes people bleed. The question, though, that I have yet to see, and I've watched more than I would like. I can't say that I've watched all of it or anything even close to all of it, but of the various. Particularly the big cable networks, CNN, MSNBC, and Fox. I have yet to see, and I kept raising this yesterday, I have yet to see anybody in the news media asking why it is that Dallas, Texas now has one, probably two cases of Ebola, and as many as 30 or 40, maybe more people exposed to Ebola. And in the face of this public health, let's call it a crisis or danger. I don't think it's an emergency yet, but it's serious stuff. In the face of this, Rick Perry has not simply said to the Republicans in the Texas legislature and to the federal government, okay, fine, we will take those billions in Obamacare dollars that Texas taxpayers paid in taxes, went to the federal government. The federal government is trying to give back to the state of Texas so that they can ensure a quarter of the state, a quarter of the people in Texas have no health insurance whatsoever, and they're working. See, Texas does have Medicaid. Every state does. When Medicaid was rolled out in the 1960s, it was voluntary, just like the Obamacare Medicaid expansion is. And it took 4 or 5 years for every state to finally get to it because there were a bunch of Republican-controlled states that said, oh, we're not going to do that. That's socialism. But eventually they all got on board. So if a person is genuinely poor and not working in Texas, they're already covered by Texas Medicaid. But if they're working at the crap jobs that Texas is leading the nation in creating, Texas leads the nation in creating minimum wage and low-paying jobs. If they are working at these jobs that pay $7, $8, $9 an hour, $10 an hour in the best of universes in Texas, they make so little that they don't qualify for the Obamacare subsidies, but they make enough that they no longer qualify for the free Medicaid through the state of Texas. This is called the Red State Donut Hole. And it was created by the U.S. Supreme Court. John Roberts and 4 other right-wing crazies on the Supreme Court created this loophole. And all the Republicans in Texas have to do is say, yeah, no problem. Give us the money. We'll insure everybody. We'll cover everybody. Because we've got a public health emergency on our hands, or at least what could be a public health emergency. And we want everyone, if somebody gets a fever in that apartment building where the Ebola guy was living, handling the same doorknobs he was on the way in and out. And apparently Ebola can live, unlike AIDS. Ebola, AIDS, you get bodily fluids from AIDS victims on any surface that's exposed to oxygen, and boom, the virus is dead. But Ebola, not so much. It looks like it can live 2 or 3 days outside the body. And this fellow who finally, on his second try to get into the hospital, he was outside puking on the lawn of the building, barfing on the lawn as the ambulance was coming to get him. So this is an issue where you really don't want people to not go to the doctor because they can't afford it. In other words, this is a situation where when somebody says, I kind of feel like crap, and I got a fever, and my muscles are aching, and I'm living in the same building with a guy who had Ebola, but I only make $8 an hour or $9 an hour working at McDonald's or Walmart or Burger King or fill in the blank, right? I only make $9 an hour, so I make too much to qualify for free Medicaid in the state of Texas, but not enough to get Obamacare. So, if I go to the doctor, it's going to cost me $50. $50 is, 2 days' pay after taxes and everything else. And maybe a day's pay, whatever it is. Plus, I got to lose pay because Texas has no paid sick policy. So there's no requirement that employers give people paid days off when they're genuinely sick. These two insanely stupid Republican policies, keeping a quarter of the state uninsured and allowing employers to essentially force people to come to work sick, are as insane as it gets. Why have none of the national media, why have none of these reporters, none of these stenographers, none of these commentators, why have none of them looked into the camera and said, why isn't Rick Perry expanding Medicaid right now to deal with a public health crisis in Texas? Why isn't the Texas legislature talking about paid sick days to deal with a public health crisis in Texas? Why are they not asking this question? Is it like everybody's trying to protect Rick Perry?
You're listening to the Thom Hartmann Program. Call 866-987-THOM.
I mean, think of this. This is really simple, straightforward stuff. This isn't rocket science. We'll be right back.